What about a special needs child? So first of all, I wanted to say there's nothing wrong with a chart. A chart, you are not going to look at a chart and go, oh, this is a chart of a special needs child, or this is a chart of somebody who has cancer. So the chart is not a diagnostic tool. It tells us how we can optimize the story of who we are. We're looking at correlations, not causations. And we're looking at a story, and stories have lots and lots of different ways of playing out. I want to lovingly and gently say that as human beings, we don't always have access to the whole story. We don't know sometimes why we have the experiences that we have. We don't know why somebody who's 16 gets cancer. We don't know why we have a special needs child. There's mystery in the story. And there's probably, I would guess, an aspect of your soul curriculum in the story. And so our lesson becomes, how do we learn what we need to learn in our human story with these choices, not these choices, with these events that happen that really are beyond our control. Some of the things that happen to us, we'll never know why, and why to a certain degree sometimes is not the right answer. Maybe or the right question. Maybe the question is, how do we bring ourselves into the highest state of alignment with the story of what is? So I want to lovingly and gently, if this is your life experience, send you so much love and support, and to really know that there's nothing wrong in the chart. And certainly the challenge is that you have a challenge in your lap and in your heart. And I want to encourage you and support you in continuing to explore, how can you bring out the highest expression of the situation for yourself and for your child, or for anyone who you may know who's in the situation. Rebbe Faraldi says, wondering about circulation, body system issues, and potential correlation with which center. It's the heart and the will, for sure, especially the will. So self-worth and vitality. Dusty says, chronic sinusitis and asthma. Where of the body would this correlate with? That's a really good one. So the breath is actually mostly associated with the gate 12 coming off the throat center. So that breath is literally part of divine connection. It's a part of being in alignment with right timing. And it is, of course, part of authentic self-expression. Chronic sinusitis is more about ajna and certainty and pressure to figure things out. So if I saw chronic sinusitis and asthma together as you have, I might explore the question, are you trusting that you'll know what you need to know when you need to know it? That would be the exploration I would invite you to do, especially to explore your comfort with the idea of being supported in knowing what you need to know when you need to know it. Craig says, what about all over muscle tension and chronic myofascial pain? That is oftentimes a symptom of vitality and oftentimes a root center issue. Structural issues, musculoskeletal issues are usually root center or vitality issues. Is a very interesting thing, in particular when we start talking about myofascial pain, is the body tends to hold on to old traumas, old beliefs, old stories in the fascia and then that myofascial level. So I would also look at, is your spleen defined or open? And if it's open, are there things you need to let go of that you've been holding on for too long? And I know, Craig, that you are a projector, so also knowing when enough is enough with the holding on. And are there fears that you're holding on to in that fascial layer? Hands and swollen knuckles. So hands are interesting. Structurally, I would say that's root and vitality, but hands are also extension of the heart. So that extension of the heart is also about authenticity, direction, and anything associated with the G center and the will center. So eczema is considered technically autoimmune. So I would definitely, again, look at everything I said about the gate 26 and the will center, and also potentially a little bit of vitality there too. So Danielle Marie says, is the emotional solar plexus associated with diverticulitis? Yes, absolutely. That is oftentimes most associated with the 3955, that channel, but also the other channels connecting the root to the emotional solar plexus. The bladder is kind of an interesting issue. Bladder is primarily root center and emotional solar plexus. So it's kind of a cusp, if you want to call it, it's a cuspy, it's on the cusp between the root center and the emotional solar plexus. So that I would associate it with those two. It's associated with hydration and absorption. So that kind of falls more in the emotional solar plexus.